It's time for Good Living segment right here on Prime Morning. My name is Dua Akumia. Get ready to be interactive with us on all our social media platforms. Today we're going to have a very interesting conversation. For those of you that have kids, you've got nieces, you've got nephews, this conversation is great for you. We're going to talk about the general health of children here in Ghana. And so I have seated with me. Earlier I did say that there's an expert that will be joining us. And her surname, the pronunciation, my goodness. But Anastasia, Dr. Anastasia is here with me this morning, and I'm going to give her the opportunity to tell us the correct pronunciation for her surname. Hi, Doc. Good morning. How are you?
Good morning. I'm doing well, thank you.
Oh,
How are you doing?
I'm doing good as well. Your surname?
It's Prosorova.
Okay, you see? I just couldn't have tried. I just couldn't have bothered. But Doc is the General Secretary, Pediatrics Society of Ghana, Greater Accra branch. And so we're going to talk on improving child health care here in Ghana. That's the conversation for today. KMJ will be joining me pretty shortly for us to delve into that. But generally, when we say child health care, Doc, what are we looking at on the whole?
Yeah, it's quite a broad terminology, but as a Pediatrics Society of Ghana, we are trying to subdivide or pick up some particular topics in child health for the whole year. So we work on particular topic for the whole year. And this year we are working on universal health coverage. We are trying to bridge the gaps, identify the gaps, and then bridge them. Because, as you said, it's quite health is quite a big term, and we are trying to understand what have we done so far good and what we are yet to achieve. So basically, that's what we are working on.
So what exactly would you start with? KMJ is here, by the way. Kay has joined us. Kay, you good?
Yeah, I'm good.
What happened to you?
I was waiting for Felix Ofusukwache. He's supposed to come to Joyful.
Okay.
So we're just trying to see.
Okay, all right. So yeah, Doc is here for us to get into the conversation of
Yep.
improving child health care here in Ghana. Hey,
and look, I love children, by the way. I'm very passionate about children. So this conversation is something that means a lot to me, especially their healthcare and education. So I think it's one of the conversations that we don't really pay attention to, you know, in terms of how we've been able to support children in terms of their care. So yeah, it's really something that I look for.
Yeah, I asked her a question and she started on, by saying it's a broad, if you have to talk about child health care in general, it is very broad. But the Pediatrics Society, they are narrowing it down and, choosing specific areas that they're going to give us more information and more awareness on. So I was about to ask Doc to throw out some more highlights into specifically what you want to talk about.
So when we are talking about children generally, we are talking about person of different age groups. So basically we divide our children into specific age groups, starting from babies or neonates, and then to preschool age children, school age children, adolescents, or so teenagers, adolescents, those who are more than 10 years old. And this year particularly, we are concentrating on these people, so children of 10 years and above. So we'll talk about their particular issues because it's a specific age in child's life when they're not adults, but they're kind of overgrown, smaller children. So they have a lot of peculiar issues in this age group, starting from behavioral issues. Now they look at their self-esteem, whether they are related to other peers, whether they are worth to be in particular group, and if they experience some peer pressure or bullying in school, they see themselves as so different and they cannot be in relationships with their friends, with their neighbors, with their family, and that actually creates another problem in them, psychological and psychiatric problems. And then, of course, general health, when we're talking about our adolescents, we realize that now the overweight, obesity in these children is also on a rise, and that also can contribute to their lower self-esteem. So that's one of the gaps we are trying to cover during this year, the adolescent health and then attributed problems in adolescents. And also we realize...
Doc, before you continue, sorry to cut you. The obesity part, I've actually been wondering, KMJ, because there are a lot of times where some children what would you say would be the correct or right weight for a child, especially from age 10 going, for an adolescent? What would you term as the healthy weight?
So for children, the healthy weight is a bit different from adults because apart from increasing in weight, they're also increasing in height. So usually we have special charts and then special diagrams. We use child's age, child's height, and then we see how all these parameters are correlated. So sometimes we also use body mass index or BMI, the same we use in adults. But again, we recalculated based on the child's height and age because 10-year-old will be of different height and weight than 13 or 15-year-old. So basically what we recommend is routine or let's say yearly checkups when the child can check his or her weight, height, and then we take it from there.
Doc, in general, would you say that parents have been able to care much about your child's health in as much as you do? Do they bring them? Are they able to assess, your places to talk about how their children are growing in terms of their health? Have we done well with that?
So that is another gap we identified there. We, as pediatricians or healthcare providers who work with children, always advocate for family-centered care. So we do not do something separately from the family. So we want to work together with the families because parents are basically or primary caregivers are the main people in child's life from the babyhood and then growing into adulthood. And we realized whilst we do our studies that only 10% of families have conversations, like open conversations when it's maybe, let me say, sensitive conversations when we are talking about...
Only 10%?
That's low.
Unfortunately, 10% is quite low. That study particularly investigated the conversations on sexual and reproductive health. So that's a quite sensitive issue, And sometimes we have these parents who come to our clinics, or even when we are on media, they ask us, so how do we initiate this conversation? It is very difficult. And also the level of relationships between, let's say, mother and daughter, or daughter and father, father and son, father and daughter. So the level of openness, how far they can go. But we always recommend to start from the needs of the child because in fact, most of children will not ask you so many detailed questions. They'll start from one and check you. So what will be the response? Will yourself be shy or not comfortable, not confident to talk about? You'll say, oh, what are you talking about? And all that.
Based on that, they also now start with a...
And then they withdraw.
They'll be able to open up.
And then, but this is the age when the very adventurous and they want to explore the world. So if you as a parent will not provide an answer, she or he will definitely get this answer. But again, what will be the source of this answer? Will she go to her neighbor or her friend or some not so trusted adult?
Which is risky.
Which is very risky, which can cause other problems and push the child into risky behavior, which can cause other problems, because use of drugs and alcohol is quite on a rise at this age group. So we recommend that if parents feel that it is not so easy for them to initiate this sensitive conversation, it is better to maybe bring the child to the clinic where we have pediatricians, where we have healthcare workers, clinical psychologists who can initiate the talk together with the child and the family around.
Would you say that suggesting such a solution, that children within that age would prefer to speak with a stranger or open up to a stranger rather than his or her parents?
No, that is quite dangerous, but it is possible. Sometimes it is dangerous if you don't have any idea who is this stranger is. But if it is, again, clinical psychologist, I understand where you are coming from. Sometimes we do not go straight into sensitive issues. So usually we have actually a questionnaire or a special tool we use with these children, and we usually start from not so sensitive questions. For example, so how do you do in school? So do you have a special subject you are so good in, and how do you feel, how do you relate with your peers? And sometimes they don't want to go straight to their issues. So sometimes we ask, so do you have any friends around you who maybe have some issues in school, maybe who have been bullied or who were involved in some activities like maybe taking of alcohol during some gathering? So we start from there, and then it actually takes several sessions. So it is not like immediately you go straight to the point. So you start from somewhere, and whilst you are establishing rapport, again, parents are around, mother or father, so they will be also involved. So you can actually take it from our clinic, take it from our consulting room and carry home. So you can continue conversation at home. Again, you have some problems at home, you don't know how to address specific question. Come back and let's talk about it together. So basically that's what we are working on.
That's nice.
Interesting stuff. I want to find out again, if we're looking at the children, how they grow up and become whatever they want to become. I mean, obviously, it's going to be starting from how we're able to bring them. In terms of choices, some of these cases, when you're trying to make choices for them, it's difficult because they meet their friends, they have conversations, their minds are beginning to open and all the things they want to be doing. How do we help them make better choices for themselves in terms of health?
Yes, it's true. Now, media and then all
picking so many information from a lot of places,
platforms, and then many kids have easy access to gadgets, to not even talking about internet, even TV. You open your TV channel and they tell you something, you are confused, you are not sure. So basically what we can do for them is to provide reliable sources of information. And also, we always advise parents to be around. Of course, it is not possible. We are all working parents and it is not possible to be around. But again, it starts from the trust. So trust, and then the conversation between the child and the family. So you can come together and see, so what do you want to know? So they'll tell you, and then you preferably together, try and find the reliable, we have actually reliable sources of information. So the Ghana Health Organization, World Health Organization, if it is related to the health, we have reliable data, we have reliable sources of information. So if we come together, parents and the child, and we are looking at particular question, you can get information from reliable sources. Again, school, it's very important. So now I think during science classes, during other after-school activities, there is, even in schools, there are counselors who can also help you with the issues. So basically, we always look at the child's environment. So you start conversation and looking for the answers at home. And then now school, what school can provide? So again, it should be education of teachers. So what information can you give to the child? Some teachers can be a bit shy to give some sensitive information. But at this age, children are actually looking at trusted person, and teachers are amongst them. So if teacher tells them, so that's, you have to be hygienic, you have to bath, you have to change your clothes, you have to take care of your of yourself, of your diet. So how should you eat? So what should you eat? And again, if at school we provide not so healthy food, the child will be a bit confused. So, but you feed me with this food, now I come home and you say, this is junk. So now what should I do? So you have to always be very open with the child and never lie. So lie is never a way forward. So try and be consistent. So talk to the teacher. Usually when we have some behavioral problems in children, we want to know the environment. So we actually ask mother's or father's point of view, and then we want to talk to teachers, because majority of the time children are at school. So how is the child at school? Any problems with relationships with peers? And then the extended family as well, because in Ghana, we know that there are trusted relatives. So basically,
always around you.
Exactly. So it may not be a mother or father, but maybe auntie or sibling. So we
some
take
with your grandmothers, some
grandmothers,
very young with your grandmothers.
Exactly. So some of them, they stay with grandmas, and then again, in this situation, we try to talk to primary caregiver. It is not necessary parents. It could be a grandmother, grandfather, auntie. So basically, that's the advice we give. Let's look for information together. Let's see what we are teaching our children at school. What information can we look for on our media platforms, in internet? What just our life experience. Sometimes if we tell the girl how I was going through all the problems you are going through currently, it will help her. Because you know, adolescent age comes with puberty. And then again, the body changes. And that alone can be so stressful that the child just closes up, and it will be very difficult to help when the help is needed. So basically...
And it's scary. I mean, especially when they're getting into the adolescent age, and you realize how much of a burden it's on them, because they have no idea what they're getting into, and you, the parent, is not also around.
Especially, you know, with the communication that Doc mentioned, if there's that huge gap between the parents or the guardian and the child, it will be very easy for him or her to feel, I'm alone, I don't have anybody, and keep everything within them. But you did say that that is one of the gaps that you're trying to bridge. What other gaps have you identified?
So we identified, so there are actually so many gaps in our healthcare system. So when we are talking about universal health system or universal health cover for all children, what does it mean? It means the child, independently of the age of the child, socioeconomic class of the child, location of the child, should have the best quality medical care, and it should not be a financial burden for the family. But currently, looking into our economic situation, our insurance, it's a problem because it just covers some basic things, but parents are forced to pay out of pocket. And that alone can actually bring another problems into this child family, because when we are talking about family-centered care, we are not only taking care of this particular child, of our patient, who, let's say, came with malaria, who came with respiratory infection. Yes, we'll take care of this child. But what about other siblings who are at home? Now that mom or dad have to pay out of
all
pocket
their monies into one child.
Now we are looking at malnutrition problems at home. So that will start the vicious cycle. Now you have to take care of those children who were affected, bring them back. Even sometimes bringing back to the healthcare facility is a problem, because the distance, and then parents have to pay for transportation. When they pay for transportation, now we are giving them bill to do some laboratory investigations, to buy some medications. So that basically causes another problem. And it is probably less prominent in bigger cities like Greater Accra region. But if you look at the other places, you feel it very strongly, because the gap is there, and we are trying to we identified it, but how to bridge it, it's a problem, because it does not depend only on us, not only healthcare professionals. And even availability of healthcare professionals is another problem, because if you come to a smaller district, there is maybe a clinic or polyclinic or CHIPS compound, some small facility where you need time to reach to that problem. So the distance will be a problem. So when you reach there, who will you meet? Sometimes you just meet a nurse who is alone there. And now the nurse will have to refer you to another level of healthcare facility.
That may be out of even the district that you are in.
Exactly. Sometimes out of region. So you will need to again organize yourself. And of course, depending on the condition, some conditions need immediate care, immediate intervention. You cannot wait for so long to organize yourself to be transported to another level of healthcare facility. So these are some of the gaps we identified, and which we cannot close. So we are trying to concentrate on those which we can close. Another gap which we thought could be possible to at least bridge, maybe not completely close, is the gap of unavailability of data. I think we started talking that we need data to see how well or how bad we are doing. And we realized that we do not have enough data in our, let's say, sub-region or our country. So we need to invest, and we need to start more research projects on particular issues of child health. So we are aiming to organize and conduct more studies of different problems in child health. And we think that when we have this data, we can show to our policymakers and then the higher levels of institutions and then stakeholders to see that we are really facing problems.
You get to understand the reality.
Exactly. So if you have data, you have evidence. So we think that that evidence will actually help us to start bridging other gaps I mentioned.
You know, look at it, seeing these kids holding the NHIS cards. You mentioned something, Doc, that the insurance only covers the basic. So when you say the basic ones, what really are we talking about?
So if we are talking about NHIS, it will cover admission fees. So basically, if we are talking about inpatient children, mostly it is just admission fees it covers. So you will have your bed, so you can stay in the hospital. But majority of labs and then medications, it will not cover.
Ooh.
And that's what the major problem is, because admission, really, how much would admission cost you? But these are medications the person would have to live on to recover from whatever sickness.
Running lab tests here and there.
So that's what the major issue actually is. So if it's not covering that area, obviously you have to know nothing at all. So I think it's one area that has to be really looked at as well. One thing that I also want to find out is when you have interaction with parents about the well-being of your kids, if you decide that, okay, we want to call our parents together, we want to ask a few questions so they can also ask you questions on how you can help improve, their children's well-being and all that, do they show up? When you, and because you spoke about data, when you invite the parents that want to talk about your kids, or maybe a seminar or something that your team puts together, and which is solely for the parents, do they show up? Are they encouraged to come?
So usually as a Pediatrics Society of Ghana, we identified, again, particular problems or diseases or conditions we want to highlight not only to the parents, but also to basically to everyone, whether you have a child or you are yet to have a child, it doesn't matter. So, for example, some of the days, May, we are celebrating neonatal jaundice. In September, we are talking about childhood cancer. So basically, we identified particular conditions in every month of the year, and we organize a lot of advocacy programs. So, and as I said, there are different levels. So we start from our facilities. So we do not actually invite parents. We just talk to those who are available. So let's say parents brought their kids for, let's say, postnatal care. So babies, mothers came with their babies for their postnatal care for weighing clinics. So we talk about problems in babies, in neonates, in infants. So let's say age category of 1 year. So now we go to OPD, general OPD of child health. So we talk about problems of bigger children, so preschool age children, school age children. So we also do school outreaches. We go to different schools. We talk to children themselves because it is important for adolescents and teenagers. So those children who can understand and who can take care of themselves, they should be involved in the care of themselves. So we do school outreaches. We talk to teachers as well because we want them to be on board with us. So basically and then we organize stakeholders meetings. So when we have these large programs, we talk about particular, like the one we will have in February. So we'll have one huge conference. So it is annual general scientific meeting, and it will be in February. So first week of February. So we'll invite all stakeholders from different organizations. So Ghana Health Service, Ministry of Health. We'll invite representatives from World Health Organizations, UNICEF, so from different, not only local, but also international companies. We will invite all pediatricians, so not only from Greater Accra region, it is all over the country. So we will have representatives from all regions. Then pediatric nurses, physiotherapists, occupational therapists. So when we have this big conference, basically we are trying to teach or train the trainers. So we expect that when you come for such conference, we discuss problems, and we discuss problems for a year. So based on this discussion, you go to your facilities and you continue education. You continue organizing programs at the level of your facilities. You can go to communities. So it will be difficult to call for to parents to come because, first of all, how many parents will have enough funds or enough time to come and sit in one place. So what we recommend is public health nurses, doctors, pediatric nurses to go into communities and then organize health talks there. It should not be such a long program, just maybe few topics or even one topic, but you answer the questions. We're also thinking about hotlines, but we are still trying to see how we will be able to organize it. So that, for example, a few months ago, we had a program on breastfeeding. We realized that in Ghana, breastfeeding rates are dropping, unfortunately, and we know all benefits of breastfeeding. And when we organized this program, one mom called us and she said that she was not even told about benefits. When she had problems with her breast, no one was around to address it. So she quickly switched to formula because she also didn't want her baby to starve and cry. So we think that if we address these questions which are so peculiar to a particular person, and we will take it from there to the higher levels and then organize it, let's say. We are trying to do it nationwide, but we have to take it from, bit by bit, initial level. And then if we train trainers, we can spread the word across the country. So basically, that's what we do.
Is the society rich? How do you guys fund yourself? All these things you're talking about looks like a very big project on your hands, but I don't know how much of investment you guys have made that is making you able to do all that.
That's true. So it is non-profitable organization. We are always open to sponsors and supporters. So basically what we do, it is voluntarism. So we do it voluntary. We think that it is not enough to just sit in your consulting room, prescribe some medications, and then that is it. We think that it is important to prevent the problem. So if you prevent the problem, it will be more beneficial to a child, family, community, society, and the country as a whole. So that's how we started. So basically, we do not have any funding. It is a voluntary organization, and then if you want to join and support us,
your arms are wide open. How long have you been in Ghana?
We are in Ghana for almost 20 years. So actually, it is from us. It's from Ghanaian pediatricians. So it is not something imported. It is locally made. Our professors, our senior colleagues started it. It was initially a small organization. And whilst we started training, again, training is very important, training of more pediatricians or those healthcare professionals who are interested in child health. So that's how we continue growing, and then we hope that we will grow even more.
You know, I asked how long you have been in Ghana, because the follow-up question I was going to ask you was, when you started and now, do you see it as there has been improvement or a drop when it comes to the general health care of children in Ghana?
Exactly. So that's that to answer in details this question, we need data. So that's why we realize that we do a lot. We do a lot of advocacies. We organize a lot of programs, but we are still lacking the data. But what we realize with time, within this 15 to 20 years of our existence, we realize that our numbers as those healthcare professionals who are in love with children has significantly grown. So now we at least have pediatricians in almost all regions in Ghana, which is very good. And then pediatric nurses as well. And now we do not train only pediatric general nurses. We try to train neonatal nurses, so those who take care of babies, so NICU neonatal nurses, then general nurses. Now we are even, for us pediatricians, we are trying to subspecialize. So we are trying to have pediatric nephrologists who take care of only kidneys. Of course, you take care of other children, but you are interested and your specialty
is more with kidneys.
It's about kidney problems, or pediatric cardiologists, so those who take care of the heart. Pediatric infectious disease professionals, so those who take care of infectious diseases. So that's at the level of training. In terms of your question, in terms of the outcome, whether I can talk about facility by facility. So when we talk to our colleagues, yes, we realize that in bigger facilities, let's say tertiary or teaching institutions, we have less cases of neonatal jaundice, or we have the better outcome. So we do not have as many kids developing cerebral palsy due to neonatal jaundice as it was before. But again, when we talk to our colleagues on peripheral facilities, smaller facilities, we still have a lot to do. We realize that despite what we do, we still need to do more. And again, at this level, sometimes it is not only about us, because you need equipment, you need medical personnel, you need some things should be free for parents to access those services. So basically, we see it as a gap. We want data, and then we can proceed with it and then do more.
Okay.
There's a lot of work to be done, actually, if you're looking at it. But, I mean, congrats to you and the team. I think that with the kind of improvement that you've seen, it's not easy, especially when you know funding is always a problem, and the fact that you continue to, do this even in your little way. How do you see your growth in the next 10 years? Do you think that we're gonna understand, or we're going to have parents understanding that the welfare, the healthcare of their kids are very important, and so they will do better?
So we think that we'll continue with our advocacy projects. We'll continue with organizing programs, but we hope too that other stakeholders, Ghana Health Service, now they're also trying to be together with us, come on board. Ministry of Health, we think that we need to change some of the policies or bring new policies that will actually change the health care of our children. So we want to do it bigger. So we don't want just to stop at the level of advocacy, talking about problem. Yes, we agree that there is problem, and it is not one single problem. There are problems, there are gaps. So let's talk about children together. Again, where we are coming from, for some time, children were ignored. They were neglected. So we were concentrating on adults, on infectious diseases, on hypertension, how to take care of diabetes, but it was always about adults. And children, we were thinking or seeing them as a small adult, but it is not so. We already spoke that child goes through many changes, and psychologically, the structure, the internal organs, so basically everything changes. So child is not a small adult. So we think that if at a higher level, so at a level of ministry, all of us, we agree that we need funded programs, and maybe new policies should be implemented. That will actually help us to move forward.
I think growing up, when we were kids, you see a newborn baby and they will tell you that as for newborn babies, it's God who takes care of them. So you don't have to necessarily pay too much attention to them in terms of their health. They can even tell you, oh, the baby is choking. Yes. And they'll say, oh, don't worry, God will handle that for the baby. And I'm like, okay. It's true. Kids, children have been neglected because the adult is like, oh, you're going through a lot. You have so many things. Exactly, you're aging. So all the attention is on you. But the kid, we're just saying, oh, this one is just something small. So I understand, where you're coming from. But I'm hoping that moving forward, we'll be able to do better. Just like you said. Is there any special thing they do?
So I believe you have a theme, the Pediatrics Society. You have a theme for this year. What's it?
Yes, so it is the team we started talking about universal health coverage for all children, and we are trying to bridge the gaps and build resilience. So we are trying to see what can we do, at least at this level, what can be done, and then let's take it to the next level.
If somebody wants to be a part of this, contribute, support, how can the person do that?
Yes, so they can contact us. We have a website. Actually, it is Pediatrics Society of Ghana. You can go to that site. You can see what we are doing, read about us, what we are planning to do for the year. You can donate. You can contact us, and we will take it from there.
Okay. Some of the institutions, too, if they want you guys to come and then you have sections with them, maybe their church, maybe a small group who want to have you to also come and speak to them, they can also go through the same process, right?
Yes, they can. That's what we usually do. So you basically contact us. There's an email address there. There's a contact phone number, so you can easily reach us, me or our national executives, and then we can work together.
For a parent who believes in going to or adapting more towards home treatment instead of seeking professional medical help for their children, what would you tell them?
Yes, so we are not against, so some parents or some caregivers are scared that when they come to the hospital and then you tell us that, oh, I've already applied some cream, or I boiled some herbs and bathed my child. We'll be extremely furious and angry and shout. No, we are not like that.
Okay.
So it's just important to understand that there are different conditions and there is different severity of each condition. And some conditions should be addressed very fast. And if you delay by trying something which is not supposed to be tried, you will rather harm the child. So some of the examples, simple examples, kidney issues, when the child's face become puffy, or maybe the abdomen becomes swollen, legs become swollen, and you continuously bathing the child with the herbal preparation, or you give child some herbs to drink, it can actually worsen the condition, and the golden time is lost. Not talking about babies who need just let's say minutes or hours to deteriorate so significantly and drastically that when you come to the hospital, we are not able to do much. So please, we are not against of herbal preparations. In fact, many of our chemical or our medicines we use are made based on some herbal preparations. Let's talk about antimalarials. Many of them are based on some initial herbal preparations. We are not against them. What we are saying is that each condition needs different care, different management. So, and now that we progress to this level of medicine where we can give care. Again, of course, we understand that it is sometimes not easily accessible, but we are advising that let's try and work together. You think it is your cream or your herbal medication will work, but how sure you are? If you are not sure, and mostly even if you are sure, but you need second opinion, because even as a doctors, we know conditions, but we are not shy to ask our colleague. It is not because we know less, but you know, two heads are better than one. So we advise our parents, our primary caregivers, please bring the child. Let's just have a look at the child, because sometimes there's no even need in some medications. We'll talk to you, give you advice, and you go home. But if it is something serious which needs care at the level of hospital or clinic, please bring the child and let's work together.
What would you see as the first go-to wrong thing that a lot of parents do when it comes to their child's health care?
So again, it depends on the age of the child. If we are talking about babies, neonates, so we see a lot of things which are done, still done, in the house, bathing babies with cold water, applying some charcoal dust, toothpaste,
weird things.
Toothpaste on their umbilical cords, massaging babies' heads to so-called mold, to shape the head, to give some glucose water instead of breast milk. So we have still a lot of myths, misconceptions, traditional beliefs at different levels. Again, these are all gaps we are trying to bridge. So taking care of children with special needs. So some disabilities, some of them, they see them as creatures, not really human beings. We still face a lot of infanticides when kids can be killed for their condition. So looking into adolescent period, depending on the condition. So I spoke about kidneys. So again, what our parents do, some of them, they actually our clients, so they come to the clinic, and because it's a chronic condition, many kidneys conditions can be chronic conditions. Sometimes they come to the clinic, come to the hospital, and that at some point they're just fed up, they're tired, they can't be doing it again. Then they use smaller doses of prescribed medication, so they'll just buy smaller doses of medication and give to the child. And whilst they're doing it, they are rather harming the child, because the child is not in out of condition completely. We call it remission, when there's no problem with kidney at some particular point. So a child is not in remission, but still you think that everything is fine, and then kidney function keeps deteriorating. And when you come, the kidneys are so damaged that we cannot do much. So child needs kidney transplant. So as I said, you start from the babyhood into adolescent, and we see still a lot of gaps and still a lot of misconceptions.
Because if you've checked very well, quite recently, you have had issues of children with certain diseases, kidney, this and that. We need so amount of money to go and take this child to this place to go and take care of the child transplants and all of those things. And so I think that it's one thing that we really have to pay attention to.
Because like gone was a time where certain diseases we're only hearing cases of that in adults. But it's like right now there's a rise in such diseases.
And they're flying on social media. We need $250,000 to go and save this child. We need this and so amount of money to go and do transplant. We needed this. And I'm like, okay, is that what we're going to right now? And it's scary.
Yeah, so it is not like these conditions were not there.
Okay.
It is like they were not diagnosed or they were not thought of as a medical problem. They were thought of, people were thinking that it is, let's say, spiritual problem. And then there are different names for particular conditions. So basically when they bring the child, there's already diagnosis. So sometimes...
They'll be telling you what is wrong with the child.
Exactly.
Instead of you telling them what's wrong with the child.
Yes, especially...
It's crazy.
Especially if a lot of financial burden are involved. So sometimes you ask the parents, go and do this lab. They do it. Go and do another lab. They do it. So you explain why you need to do it. But explanation will not pay for the lab.
Of course.
So at some point, they just decide that, no, this is not medical problem, it's spiritual problem. So let's take it from the other angle. And again, it's a long medical legal issue now take place. We explain that child is not an adult. Child cannot take care and cannot take decision for
themselves.
Herself. But if mother goes against best interest of the child, now we need to involve lawyer, we need to involve police, we need to involve...
That's another aspect.
And that's another very serious aspect of our practice. So we cannot just allow child, let's say with cancer, we know it is cancer. We know we can start treatment and child can be cured of it, but you are telling us it is not medical problem. We cannot allow the child to go home and die because of cancer. So all these problems were actually there, were in existence, but it's just we are trying to change people's mind and traditional beliefs to change and then to
make them understand
treatment.
that this is not spiritual, it's what you're thinking, it's a medical condition that
which can be cured actually. And child can survive and live normal life. But if you stop at this point, or if you do not initiate treatment, the child will die. So we are quite honest with parents. We do not hide anything. We always want to work together. But if you think that you do something which will harm our child. So the children are our priority. So we want to concentrate on them. For a long time, they were not our priority. Now they are our priority. Again, with all these cases we are hearing about sexual, physical abuse, we are always on our kids. They are our priority. And unfortunately, if parents are not with us, we have to look for another alternatives.
Because it's a collaborative effort. If you want to help and the mother says this, I'm not going to allow you to do it, how do you go about it? Of course, there are legal aspects of it as well that you have to be careful about, how you take care of.
And I'm happy. Now, parents would have to be in the know. They have to be aware. They have to be aware that if you neglect your child and you're knowing perfectly well that you're supposed to do something, especially health-wise, I mean, they could take matters into their own hands and then before you realize you've lost your child. You may have your child, but then you've lost your child. But I want us to go back to the adolescents. Okay, you said something. You said something about them, but then when it comes to adolescents, what would be the prevailing health issues that may have been brought to your desk?
So we said there are several issues in this particular age group. So we already mentioned some. If you look at the body structure, right, so the puberty comes with the adolescent period. And then when you talk about puberty, you talk about hormones. So hormones change, and then the body of a boy or a girl also changes. So girls will start having breasts, they will start menstruating, so the boys will also have changes in the genitals, and all these changes, physical changes, can bring the psychological problems. So some of them come because there is actually, maybe there's a question on menstrual cycle, but because they're shy to come to you, they may tell, Mom, take me to the doctor because I have abdominal pain. Or maybe I'm not feeling well, I'm feeling weak. Or maybe my head is aching. So it could be something completely unrelated to the main problem. And that is why we understand that it is important for us to separate this age group from other age groups. So from smaller kids, they should not be in the same clinic as adults who come with their specific issues, and they should not be in the same clinic with smaller kids, because it is a particular age group, and you need to take your time. And you need to give them privacy, and you need to listen to them carefully. And you need to listen to them separately from caregiver. So sometimes what we do when parents come with a child, we listen to particular problem, the presenting complaint, what they are complaining about, and then we ask mom to excuse us. And then at that point, we really talk to the adolescent. And again, the space, when you excuse mom, it doesn't mean that there's another doctor sitting there talking to another family. So it should be basically
the both of you.
One consulting room. So sometimes we ask for a chaperone, or maybe nurse can be present. It's not a problem, especially if it is examination time. If you examine private parts, we always want chaperone to be around. So a nurse, usually, or another colleague, so it should not be independently of the gender, whether it's a boy or a girl, and whether the doctor is a male or female, so it doesn't matter. So you start again from somewhere. So how do you feel at school? Do you have problems? Do you have someone who maybe started dating? having a boyfriend, girlfriend.
Yeah.
What do you think about it? Then she'll start opening, well, yes, so someone has it. So do you like someone in your class or in your neighborhood?
Yeah.
So basically you start asking a question. Again, some will not open it, the way you asked about strangers.
Strangers,
so stranger anxieties, or maybe the person does not like me, does not feel safe in my presence. So you can ask, so do you mind to maybe talk to my colleague? Maybe a boy prefers to talk to a gentleman, male doctor. Do you want male doctor to come, and then you discuss? So some of the issues are not related. And then it is important to pick up those things. As I already said, we have special questionnaires because it is not only about physical problems. Physical, well, yes, you examine the child, maybe there's some problems with nutrition, maybe the child is too slim or a bit on the bigger side, maybe the sugar is not under control, diabetes, maybe you check blood pressure, the blood pressure is on a rise. But generally, they're quite healthy people unless there is some chronic underlying problem. But psychological things is very important to pick up psychological issues in this age group. I already mentioned that they can have problems with their self-esteem, and that alone can push them into depression. It can push them into suicidal thoughts, and some of them can actually commit suicide. So it is not just thinking about suicide, but even ending up your life by committing suicide.
All right, Doc. Yeah, I wish we had some more time to talk more into this because the conversation got more interesting. But Doc, thank you so much for your time this morning. It's been very informative. I have learned so much, and I know that our viewers have learned a lot. Okay,
very
I've really
insightful
learned a lot.
conversation.
You're going to be a father.
There's
soon,
a lot to be done. There's a lot to be done. So we'll do our best.
Yes, definitely. So yes, our guest has been the General Secretary of the Pediatrics Society of Ghana, Greater Accra branch, Dr. Anastasia Prosorova.
Prosorova.
Thank you very much.